Urinary incontinence is the involuntary or uncontrollable leakage of urine, and it can happen for different reasons. There are two broad types of urinary incontinence, and one is what we call urgency incontinence, and this is the leakage of urine when you have a sudden urge to pass urine which you can't control. The other type of incontinence is called stress urinary incontinence. And this type of incontinence is more commonly seen in women and typically happens after childbirth. This is the type of incontinence that happens when you're moving or physically active, or leakage of urine when you're coughing or sneezing or laughing. Urinary incontinence is a very common condition. In fact, it affects millions of people worldwide, and lots of studies have shown that it affects anywhere between 10 to 15% of all people. And it's commonly thought that this is a condition of women only, but in fact, it's equally common in men, women and children. Urinary incontinence can be caused by a number of different things, and it depends really on the type of incontinence that we're talking about. So urgency incontinence, which is the involuntary leakage of urine when you have a sudden urge to pass urine, can often be caused by a number of conditions that affect the bladder. And it's important, if you have these symptoms of passing urine very frequently, or going to pass urine at night time, or having leakage of urine because you can't control the urge, that you have your bladder checked. The commonest causes are things like urinary tract infections, diabetes. In men, we commonly see enlarged prostates that can cause these overactive bladder symptoms. And a lot of the time we don't know what causes the incontinence. Sometimes people can have problems with the nerve supply to their bladder, things such as multiple sclerosis or Parkinson's disease, and that can also cause these kind of overactive bladder symptoms. And very rarely, people can have abnormalities inside the bladder, such as cancers or stones, which can trigger these symptoms. And so it's very important, if you have symptoms of urgency incontinence or passing urine very frequently, that you have a full evaluation by a urologist. Stress incontinence, which is the leakage of urine on coughing or any physical movement, is most commonly caused by childbirth. And the higher the number of children a woman has had, the higher the risk of weakness of the pelvic floor muscles, and this can lead to incontinence. There are other things that can cause stress incontinence, and we know that increasing age, being postmenopausal, and being overweight can also increase your risk of having leakage of urine on any physical movement. In men, urinary incontinence can also result after surgery for any kind of treatment on your prostate, either enlarged prostate or prostate cancer, and can again lead to symptoms of leakage of urine on coughing, sneezing or moving. So if you have any of these symptoms, it's important to have these checked, as there are a number of underlying potential causes and there are lots of treatments that can really improve your quality of life. The overactive bladder can be very successfully treated. There are a number of things that we can try to improve these overactive bladder symptoms, and we often start with the simplest measures. First of all, we would perform modification of your fluid and lifestyle, and so this would involve a detailed assessment of what type of fluid you drink, how often you drink, and at what times you drink throughout the day. This can then enable us to modify your fluid intake to reduce your risks of frequency and urgency of urine. Commonly, caffeine and alcohol can increase your risk of overactive bladder symptoms, and so reducing these can make a significant difference to your symptoms. We often advise performing a bladder training and pelvic floor muscle exercises. This should be done with a trained medical professional or physiotherapist and can significantly improve symptoms in a high number of patients. This is also especially recommended during pregnancy to reduce your risk of incontinence, and it helps to strengthen the pelvic floor muscles. For overactive bladder symptoms, if this hasn't worked, then there are a number of medications that we can try to help relax the bladder. These are again often very successful, although some patients do experience side effects, and so there are a number of other treatments we can use. We can inject Botox into your bladder, which is a short procedure that helps relax the bladder and improve the symptoms of going very often to pass urine or waking up a lot at night time to pass urine. it can also improve incontinence symptoms. The other option is to implant a pacemaker-like device into the skin under your lower back. This technique is called sacral nerve stimulation. This device sends electrical impulses to the nerves that supply the bladder and thereby relaxes the bladder and improves the symptoms of incontinence of urine. If this doesn't work, there are other surgical procedures that can be performed, and your doctor will talk to you about these depending on how bad your incontinence is and how much it's affecting your quality of life.